All right, welcome everyone to today's webinar. Today's webinar is focusing on prioritizing leadership development of the HIV workforce in health departments. Today's webinar is the first webinar in a four-part series that will be highlighting achievements through the ending the HIV epidemic. We will be sharing the slides and the recording from today's webinar with those who registered, as well as on NASTAD's website. Please feel free to use the chat function or the Q&A function at any time to ask your questions. We will have time for Q&A at the end. So here's our agenda for today. We will have a welcome and overview. Then we'll have our panelists speaking about their experiences with two leadership programs. And then, as I mentioned, we'll have some time for Q&A and discussion. We'll share some resources, and then we'll wrap up. So just to remind folks that today's webinar is a part of NASTAD's EHE Technical Assistance, which is provided through PS 19-1906. We encourage folks to reach out. NASTAD is available to provide technical assistance, and we'll be continuing webinars and other TA events such as this through September of this year. Here are our panelists for today and our presenters. We'll first start off with Maria E. Alvarez, who's the Capacity Building and Technical Assistance Lead in the Program Development and Implementation Branch in the Division of HIV Prevention at CDC. So Maria, I'm going to pass it on to you for our welcome today.
Thank you so much, Krupa. Good day, partners and HIV prevention workforce. As Krupa stated, my name is Maria E. Alvarez, and I serve as the Capacity Building and Technical Assistance Lead. So on behalf of CDC's Division of HIV Prevention, Program Development and Implementation Branch, we are pleased to welcome you all to today's webinar. Thank you for taking time out of your busy schedule to join us. CDC and NASTAD really are pleased to launch our most recent PS 19-1906 four-part webinar series, Achievements in EHE. The Technical Assistance Series will showcase accomplishments of Phase 1 jurisdictions for HIV prevention and care activities throughout the Ending the Epidemic initiative. And presenters will share their recommendations for reaching implementation goals through the training and advancement of the HIV workforce in health departments and in community, and through novel practices. So today's first webinar is entitled Prioritizing Leadership Development of the HIV Workforce in Health Departments. And we will hear highlighted successes, experiences, and recommendations from health department workforce leadership initiatives, as well as the Minority Leadership Program and the EHE Mentorship Program. So a special thank you to the entire NASTAD TA team for their ongoing assistance, leadership, and partnership to end the HIV epidemic, as well as to all webinar presenters. CDC remains committed to the provision of quality TA services, and we really hope the health department staff and partners actively participate in the ongoing webinar series. If there are any questions, please submit them to the PS 18-1802 or PS 20-2010 at cdc.gov mailboxes. Thank you, gracias, and really enjoy the webinar. And back to you, Krupa. Thank you for all your work, Krupa.
Thank you, Maria. Our panelists today are Vrushab Shah, who's the Senior Manager for Digital Content and Leadership Development at NASTAD, and is also one of the facilitators of the Minority Leadership Program. We'll also hear from Keishla M. Melendez-Rosado, who was a participant of the Minority Leadership Program and is the Training and Standards Coordinator in the Division of STD Prevention and HIV Surveillance at the Massachusetts Department of Health. Then we'll hear from Allison Heinrich, who's a manager in the Health Systems Integration Team at NASTAD and is also a facilitator of the EHE Mentorship Program, followed by Lori Armstrong, who was a participant in the EHE Mentorship Program and is the EHE Lead and Federal Program Specialist in the Division of Epidemiology and Health Planning at the Kentucky Department of Public Health. So before we pass it on to our panelists, why are we here today and why are we talking about leadership and workforce development? So we know that leadership development is essential to HIV prevention and care program implementation. Without innovative, passionate, and effective leaders, our programs cannot thrive and advance. So it's important to invest and promote leadership development in health departments. We also know that COVID-19 has exposed a lot of vulnerabilities in our public health system, both for those to who we provide services, as well as those who are providing services. So public health has gone through a lot of changes since the pandemic. And so those leading programs need to have the skills and knowledge to adapt rapidly evolving needs of programs and communities. We also need to consider changes in workforce as a whole. Since COVID, we've seen a lot of different things happening in different workforces, including public health. People are leaving the workforce or joining the workforce for various different reasons. And so thinking about how are we going to support folks who are joining the public health workforce for the first time, or for those folks who have been working in the workforce for a very long time, how do we support those folks to sustain and promote their leadership, as well as energize the newer workforce to remain in the public health workforce, as well as have that passion to become future leaders. And then finally, we want to ensure that public health leaders at health departments represent the communities that we serve. It's important to ensure that there are opportunities for those who've been doing this work for a very long time to advance in their roles, those that are in middle or lower level positions, and then also ensuring that we're hiring, that hiring practices are equitable and not creating barriers to hiring folks with lived experience. So these are just some key points to kind of level set us for this conversation that we're going to have today. Obviously, these are things that we can talk about in depth, webinars of their own, but we just wanted to have this information there so that folks kind of understand why we're having this conversation today. And so we're going to be hearing about two programs today, the Minority Leadership Program and the EHE Mentorship Program, both of which aim to address some of these issues. So without further ado, I'm going to now pass it on to Vrushab Shah to talk to us about the Minority Leadership Program.
Thank you, Krupa. And good afternoon, everyone. It's great to see such a large turnout and to see so many familiar names on this call. So I'm very happy that you can all join us. My name is Vrushab Shah. I'm a Senior Manager of Digital Content and Leadership Development, as Krupa mentioned during the introduction. And I run our Minority Leadership Program here at NASTAD, which is now about to enter its 10th cycle. This program has been one of our hallmark workforce development initiatives for many years now and has put several leaders of color from across the nation on pipelines of success for whatever job or jurisdiction they might be from. And so we're really happy to highlight this program for you all, specifically as it pertains to the fact that so much of our health force and our workforce needs to reflect the communities that we come from. And so with that vision, we always want to make sure that folks know that this is a space that is welcoming to all of you, and certainly a place that we encourage you and your staff to be mindful of and to apply potentially should this be something that you might be interested in. So I'm just going to spend some time talking about this program, its values, its impact, its goals, and I'll leave some time at the end for questions as well. So next slide, please. MLP in general is a space rooted in social justice for health department staff of color to engage in critical conversations about job advancement. We do so by talking about a lot of different issues that come up for staff of color, including how to manage emotions, how to manage burnout, identifying racial and gender-based microaggressions and triggers, how to successfully manage projects, what effective communication looks like, time management, urgency, so on and so forth. And so this program in general has created a true launch pad for dozens of public health professionals of color to truly visualize and understand what their own leadership might look like, what roles they might play in that leadership, how to actually imagine themselves doing some of the work that they might not have thought was available to them, and then how to actually use that to operationalize that leadership and the power that they are handed to end the health inequities and address the disparities that exist in our communities. NASDAD has worked with health departments for the entirety of our existence, and we recognize the need to increase the capacity of emerging leaders, specifically emerging leaders of color in health departments, and equip them with the skills, the mentorships, the coaching, the introspection, the healing that is required for so many of the correct career trajectories, that many of them would like to go on. Many of the folks who are interested in applying to MLP sometimes come to us and say, I don't know if we'd be right for this program. I don't know if I have enough qualifications. I don't know if, this person or that person might be more ideal for what you're looking for. And we always tell them that, this is a space where all minorities of color, all people of color have the space and have the required tools they need already to be the leaders that they think that they can't be. So whether they feel like they're qualified or not, we always encourage folks to apply, because at the end of the program, folks start to see for themselves how they were already leaders to begin with and how they can hone those skills to become some of the higher level, senior level, executive level positions that maybe they never thought were accessible to them. Next slide. And so I want to just spend a few moments talking about the process of how we do this and how we actually build out a program that makes leaders of color across the nation feel this sense of belonging and place. So we have a interview process, we have a selection process, and after the MLP participants have been selected, they hone and develop both hard and soft skills that assist them as they advance through their careers in public health. And they do so with 2 different trainings, which are 2 different retreats across the calendar year. Typically, they happen a month or so apart, and they are preceded by something called a 360 assessment. And essentially, this assessment is a way to gauge how many people in their networks, their peers, other folks who might be working with them, consultants, partners, whoever it might be, how they see them as a leader. And so we always like to make sure that prior to attending the first session, MLP participants are able to understand how people around them see them, so they know what their leadership potential looks like. And then they arrive at session 1, not really sure about where they might fit in, not really sure if this is a place for them, but in a appetized and mood that they're curious to learn more. So it's a really successful setup because it gets them ready and curious and wanting to learn what they might not know about their leadership potential. And it gets them going on that journey so that they feel like they have the tools they need down the road in session 1, at the end of session 1, start of session 2, end of session 2. So once these trainings are completed, they are paired, with a peer in their cohort who will help them with professional support, with accountability. And they're also paired with coaches who have been through the program, who can mentor them and give them practice to continue honing their skills and continue honing all the different content pieces that they learned. At the very end of the process, which is to say life after MLP, we have a massive MLP alumni network, and we always encourage all of our MLP participants to continue networking with everyone that they met during the retreats, but then also with people and peers and colleagues in the field after the retreat who might not have been in their cohort altogether. And it is so beautiful to see how empowered and alive and hopeful so many staff of color across the nation start to feel when they see themselves actually being able to continue doing the work because someone else in another health department is now able to offer them guidance, offer them mentorship, and make them feel seen. And so that network development, that peer-to-peer support, which is, again, NASDAQ's TA model to begin with, has been proven to be so successful for us and a lot of the leaders of who have emerged from MLP. Next slide. And so real briefly, I just want to highlight some of the values that we prioritize and center in this space. Over the course of the two retreats, participants walk on these 5 core values that provide them the foundation to expand and flourish on their leadership journey. And as a healing-oriented program built on community support, these values ground leadership development in meaningful lived experience over arbitrary standards of excellence. And so what that all means is each of these 5 values, empathy, vulnerability, resilience, compassion, risk, and reward, are cyclical. They're always integrated every day for the 5 days of retreat 1 and the 5 days of retreat 2. And all of them at all times are encouraged. We encourage folks to be vulnerable. We encourage facilitators to be vulnerable. We encourage empathy between peers. We ask folks to take risks. We show them what the rewards are. Resiliency, from ancestral resilience to professional resilience to personal resilience to lived resilience. We remind folks how that is embedded in anyone's leadership. And then compassion for who is walking in the room, what comes with folks who are of lived experience. All right, next slide. I want to be mindful of our time. So this slide and the next slide, we can actually go to the next slide after this too. So truly the impact of MLP, right? These are some quotes that you see here. What the program has been, I'll let you all read what's on the screen. Above all, everyone truly feels connected, celebrated, time together. Folks feel like this time together was so crucial that it changed their lives. And it truly gives BIPOC folks, people of color across the spectrum, to feel like someone's investing in them. The impact is not just felt in the 2 retreats, but it's felt beyond the 2 retreats in spaces that might not be always the safest. Perhaps the boardroom, perhaps large team meetings, perhaps job interviews, whatever it might be. People feel like they got the time and the empowerment that they needed to feel like they can activate some of the lessons that they learned in the 2 retreats. Next slide. And so I just wanted to share, put, some faces and put, faces to the impact. These are the people from across, over 12 years now who have gone back into their communities and changed their communities for the better. This is not some theory-based program. This is a practice-based program. And these are all people, and these are real people who have gone back into the community and literally changed their communities for the better, have reduced disparities, have really helped eliminate inequities, health inequities for all of the people in their community. And all of them are still around in their local communities doing the work, involved in ending the epidemic. So I just want you all to see physically what the impact is of the people who've been part of the program. And there isn't a single person on the screen that I don't love and that I don't feel like I can just shoot a text to or call or email. Everyone has had so much empowerment that they now want to give that back to themselves, to others as well. Next slide. So I'll just kind of close with some recommendations that MLP has really shown us. It is a space that we encourage folks to learn from, but also share wisdom with. So it's so important to invest in staff across all titles and interest levels. It doesn't really matter what their passion is. It is important to invest in that. It's important to produce content that is culturally relevant and trauma informed. As people of color, we come with lived experiences and traumas that always walk into whatever space we walk into. And so it's so important that we were intentional on the front end about developing content, soft and hard, that is trauma informed, developing relationships with key consultants and organizational change subject matter experts. The program would not be a success without our incredible partners that know so much and also bring their own wisdom into the space. And then building in pipeline investment during the hiring process. This is a big theme that has come up from all of our cohorts. Folks want to see investment in the hiring process, and MLP has now begun to create content and activation around this need that is so important. And then, of course, prioritizing BIPOC, LGBTQIA+, and gender minorities as key populations for leadership development. So much of the feedback that we have seen is that many of our white cis partners in the field have a lot of these opportunities already shared with them. A lot of BIPOC folks, a lot of LGBTQ folks and minority folks are not afforded the same opportunities for leadership development. And we now have the data to see that. And so this is always been a call of MLP to prioritize these communities, prioritize these populations so that they also can be part of the pipeline for leadership. Final slide. I have some more information here. Once the slides are sent out, please go visit these 4 links. They offer so much valuable information, some videos, some resources that all of us have put together. It really does help flesh out what I talked about today, which I feel like was a little bit more of an appetizer. And I think this is the full menu. So please go in and take a look. Our program is always so excited to talk about what we can do and grow and expand into, and we're always all ears about that. So please take a look and then let me know, let Krupa know how we can continue to support you and how we can continue to make the program better and involve your voices as well. So I'll pass it back to Krupa now. I know I went over my time, but I think we can leave time at the end for Q&A. So thank you, everyone. It is such a pleasure and treat to be with you all. And thank you for listening.
Thank you so much, Rushab. We are going to keep moving along. So I'm going to now welcome our next panelist who participated in the Minority Leadership Program. So I'm going to welcome Keishla Melendez-Rosado. She's going to talk about her experience with MLP.
Thank you so much, Krupa. Good afternoon, everyone, and thank you so much for having me. Again, my name is Keishla Melendez-Rosado, and I am the Training and Standards Coordinator for the Division of STD Prevention and HIV Surveillance at the Massachusetts Department of Public Health. Next slide, please. I was so incredibly fortunate to be part of NASDAQ's 2023 Minority Leadership Program cohort, really alongside all these super lovely and talented individuals, as you can see in this photo here. Next slide. So this program was very timely for me. Specifically, when I was made aware of it, I had just recently accepted a new role as part of the leadership team within my division. Prior to that, I was a field epidemiologist, or as widely known, a DIS, or disease intervention specialist. And sort of my main role was to provide partner services to folks recently diagnosed with infectious syphilis and HIV. And I really love being a DIS. So, why change, right? Why go into a leadership role? And really, a couple of years back, I went to this racial equity training where I was introduced to the fish, the lake, and the groundwater approach. And it really made me think of the work that I was doing. And I realized that my work was really focused on sort of like the fish, or really the patient's immediate needs. And, after you work enough cases, you can see that the cases are different, but the needs and barriers really do follow a pattern. That's when I knew that in order to influence or be part of sort of larger systemic change, I needed to be part of a group of individuals that were looking at the lake and the groundwater. And that is when I really started to sort of think about leadership development and my role within the division. Next slide. MLP was so great, like truly life-changing, like Rushab said earlier, and I'm really not exaggerating. I personally took so much away from this program, but mainly really understanding my why. This was really important for me because, as all of you can know, working in our fields can be super rewarding, but also incredibly challenging at times. The work is never ending, and we're constantly facing challenges and having to be really creative to overcome them. But if you understand your why, you can always come back to it and remind yourself why this work is so important to you. So that was very important for me. Secondly, understanding different leadership styles. Leading a team or an organization, in my opinion, truly is a sport. It's a team sport, and no one can lead alone. So understanding your leadership team's leadership styles allows for sort of more strategic thinking and for leaning on your specific strengths as a team. And lastly, really leaning into my identities and lived experiences. I think that we all at some point had this idea of what a leader should look like, speak like, act like, or just really be like, or at least I did. And many of us may not have had role models that looked like us in leadership. So seeing people in this program that looked just like me and had similar backgrounds as I did really inspired me and allowed me to believe I too could do this work. Next slide. So some recommendations for anyone looking into leadership development opportunities, either for themselves or their staff. I really do think that the biggest barrier is bandwidth. As we all know, the work never really ends, and it can feel impossible to participate in programs like MLP with your current workload. I think it's important to assist staff in specifically identifying and actually carving out time within their schedules for leadership development opportunities. And that could include, temporarily pausing some of their job responsibilities or lighten up their current workload to make space for opportunities such as MLP. Plus, you want folks to be present and engaged during these opportunities, and it's really hard to do so when you have numerous other responsibilities on your plate at the same time. Also, providing acknowledgement and kudos, really highlighting when someone is accepted and completes a professional development opportunity. I think this not only shows like your commitment as an employer, supervisor, or mentor for your staff's professional development, but also provides visibility to other staff. If they did it, so can I, type of thing. And lastly, embrace and support change. This person will most likely come back a change professional. I know I did. I came back inspired with new ideas and different perspectives. And as hard as change can be for organizations, it's really important to embrace it and have the support from supervisors and upper management as well. Next slide. I just wanted to lastly just do a super quick and heartfelt thank you to NASTA's Minority Leadership Program and their wonderful facilitators, and to the Massachusetts Department of Public Health Division of STD Prevention and HIV Surveillance, where I'm part of the team there, and the Office of HIV/AIDS for their support throughout my participation at the Minority Leadership Program. Thank you.
Thank you so much, Keishla. We will have time for questions at the end, so we do encourage folks to either use the Q&A function or the chat function to ask your questions. Our next panelist is Allison Heinrich, who's a manager for health systems integration at NASTAD and also a facilitator for NASTAD's EHE mentorship program. So over to you, Allison.
Thanks, Krupa. Like I said, my name is Allison Heinrich, I she, her pronouns. I am so excited to talk with you all today about the EHE mentorship program. This is a program that I work on that I don't know if I should say, but it honestly excites me the most out of all my work. Next slide, please. So when we were coming up with the design for the program in our initial conversations, ultimately this came about because we knew with EHE a lot of hiring had been done. And since EHE has such a large spotlight, folks were really expected to hit the ground running, and onboarding was very quick, or even in some places kind of non-existent. So we really wanted to build out this program to be a support for people and help build the confidence and skills for them to do their jobs. Ultimately, when we talk about investing in developing leadership, it's been mentioned before, it's no secret that in the public health field in particular, we have a significant workforce challenge, particularly these last few years. We also want to think about, creating and developing our future public health leaders. We have so many amazing individuals who are leading programs, who are leading agencies, who have been doing this work for many years, but we need to think about who's going to be next and who's going to continue that work when those people ultimately step down or go on to their next adventure. We also want to make sure we're increasing our organizational capacity and adaptability, that we remain flexible, up to date, and that we're able to really pivot and navigate the many challenges and often changing deliverables that are expected of us. This program, we also hope to really enable innovation, which in particular with EHE, we're told to be disruptively innovative. EHE is very unique in that we get to be innovative and think outside the box and do things we haven't really done before to end this epidemic. And ultimately, when we're developing leadership, we're boosting employee engagement and morale. If people feel like, their team is investing in them, they want them to grow, there are opportunities for learning and growth and advancement through their organization, it's more likely they're going to stay and continue the work. Next slide, please. So our EHE mentorship program is quite a bit newer than MLP, but we launched our first cohort in February 2022, and our first cohort was a year long, so it ended February 2023. That cohort wasn't a traditional cohort style program, so people kind of rolled in and out of the program throughout the year. So based on some feedback from participants, we decided to make some adjustments for future cohorts and create a more traditional cohort style program where everyone started together and everyone finished together. So there's more opportunities for learning and networking and really building a good support system in the program. So our second cohort began in August 2023 and just recently wrapped up this past February. And we are actually kicking off our third cohort in just a couple of weeks this month. But our participants are mostly newly hired EHE program staff, so within the last year. And it's not down to any specific job title. If someone works under EHE, they are eligible for our program. So we have many EHE program managers, program coordinators. We've also had some community engagement specialists. So really a wide variety of roles, but people who are working under the EHE initiative. And we've had participants who they've been funded under HRSA EHE and also participants who have been funded under CDC EHE. So as it's currently structured, this is a 6-month program, and we started with an in-person kickoff meeting, and we also bring all of our mentors to this meeting so they get to meet their mentor in person, which has been really successful in helping build a really strong relationship from the start. After the kickoff, we meet monthly for different learning sessions on various topics to help further their learning, and this is really developed based on the participants and what they're hoping to learn more about. And throughout this process, they also have regular check-ins between themselves and their mentor to work on their action plan where they list out some goals they'd like to achieve throughout the program. Next slide, please. So these are the learning objectives for the EHE mentorship program. So ultimately, we want to help people understand the various components, requirements, and flexibilities of EHE and the Ryan White HIV/AIDS program funding streams. We also hope to help folks identify opportunities for coordination and partnership within the health department and with their community partners to effectively advance EHE goals. And also a big part of this program is developing that personalized learning plan to support faster onboarding, improve understanding of healthcare systems, and understand programmatic guidance that will help facilitate the implementation of strategic EHE initiatives. Essentially, we really want to help further people's learning, become more familiar with the EHE initiative, and just feel better equipped and confident to do their job. Next slide, please. So some of the topics that we've covered in our monthly learning sessions, and again, these have been developed based on feedback from participants, but our first cohort, we actually did an EHE 101. But that cohort was a bit unique. We had many folks who they were new in their role, but they were not new to their health department. They came from a different division in the health department. So they might have come from STDs or women, children's, or someplace else. So they were kind of brand new to the HIV space. So we started cohort 1 with this just to kind of level set for everyone and make sure we're all starting from the same point. Something that we consistently talk about is stakeholder engagement, community engagement, non-traditional partnership, and what that looks like. We talked about implicit bias, monitoring and evaluation for EHE, budgeting and fiscal management for EHE, so how to get the money out the door. This third cohort we're about to start, we are going to be talking about EHE innovations, which I'm very excited about, and we've also talked about ADAP. Next slide, please. And then I just want to highlight some of the successes that we've seen from our program. So my personal favorite is the connections that have really been made between the participants and their mentors. We have heard time and time again from some of our participants, even from our first cohort, that they still check in with their mentor still checks in with them. They meet up at conferences, sometimes at NASA's annual meeting. And it's fun to hear that, you know, it goes beyond work. We have some who have truly become friends and like share stories of vacations and what their kids are doing. So seeing the relationships develop and blossom has been very rewarding. We also have participants who've completed the program either in cohort or two, and they're actually returning as mentors this time for this third cohort, which is very exciting. And then from our evaluations that we've done, 100% of survey respondents noted that they have a broader understanding of the HIV field, including HIV science, social and structural factors of HIV, and national goals, including those of the Ending the HIV Epidemic Initiative. And then I did want to highlight a few comments that folks made in the evaluations of what they considered to be the most beneficial aspect of the program. So this first quote came from someone who said, "My mentor had many resources and ideas to overcome obstacles I encountered while creating an evaluation plan, implementing EHE activities, and running into political barriers." Another participant wrote, "The partnership with my mentor has been amazing. I feel comfortable continuing to reach out to them after the program." And this last person wrote that the most beneficial aspect of participating in the program was the professional development afforded by the experience of my mentor and the resources shared for EHE. Next slide, please. So I know that was very brief and a lot of information. So if any questions do come up, definitely don't hesitate to reach out. My email is there, and I work on this program with my colleague Darian Bannister as well, so you could reach out to either one of us. But thank you so much for your time and for listening. And I'm going to turn it back to you, Krupa.
Thank you, Allison. So our final panelist for today is Lori Armstrong, who is an EHE mentorship program alum and also is with the Kentucky Department of Public Health. So I will pass it to Lori.
Good afternoon, everyone. Thank you so much for the opportunity to speak with you today. I'm really excited just to be in a space with everyone. So I'm coming this from a very personal perspective, and my interest in leadership development. Leadership development is a process as we encourage everyone to map out a leadership journey for yourself. I did that a couple of years ago when I was going through my Master's of Public Administration, and I think it's really good to use a timeline, expect opportunities and challenges with leadership. And the EHE mentorship program aligned with my leadership goals by expanding my professional development network, affording me the opportunity to learn from an expert about EHE, plan to work from with short-term and long-term goals. And as Allison mentioned previously, the EHE mentorship program is for people that are relatively new to EHE. I have EHE months before getting accepted. So it really to be creative allowed me professional development to work with. My takeaways about leadership from the program is that leadership can be and should be consistent and stable. My mentor, we met with Allison and her team on a regular basis. My questions were always answered, and my feedback was welcome. So, and as broad as EHE, when feedback is welcomed, I think it makes you feel a little more comfortable and a little more confident. Also, it set me up planning wise to deliver a plan to keep my team and to grow members into programmatic positions. One thing coming in is basically employee retention. We had built a new to keep those positions and grow those positions and really foster those. And this mentorship program really helped do that for me and my leadership style. I was supported or even participated in a in-person meeting in Kentucky. My mentor was from New York and came down to Kentucky and helped us kind of mirror the big bets, NASDAQ states went to. And so our local organizations got to come in and develop their own big bets. And that was really exciting for him to come down and visit. And I would really recommend for health department staff members to participate. I think that a lot of time, programs come around, and I liked the previous presenter talked about bandwidth, the bandwidth for it. But I think that in terms of building confidence and creating relationships and encouraging that creativity, this is a great program to do that. And I am proud to say that I have 2 team members that will be participating in the mentorship program, participating as a mentor. And so I just think that that's a great presentation. I think it's always encouraging when we can step outside of our own comfort zone and participate in that wild, and that we are really supported in. And I'll leave you with this. I read a quote of something from the Daily Positive. He said, "A leader is a deal. So be a champion of what's possible today. Inspire others to keep going. Share a positive vision for the road ahead. And most of all, believe in others more than they believe in themselves." It's all really important and worthwhile. And so I'm not going to take up any more of your time today. I would just really recommend applying for this mentorship if you have employees with someone who you encourage them to apply, because I think that's the leader in all of us, is encouraging them and do things they wouldn't normally do. So I thank you very much.
Thank you very much, Lori. Thank you for sharing your experience. Feel free to use the Q&A and chat function to ask your questions. While you're thinking about what you'd like to ask, we did want to ask you all a couple of questions and kind of get a sense of what leadership development looks like in your jurisdiction. So I'm going to launch a poll now, and these answers are anonymous, so feel free to answer. And if you'd like to share additional details, you can do so anonymously through the Q&A function, or you can also send a direct chat to me. So the first question is, does your health department currently offer or support leadership development opportunities? So we'll just give about a minute for folks to answer that. And then the second question is, what are the biggest challenges to leadership development within health departments? About 30 more seconds, and then we will share the results. All right, I'm going to go ahead and end the poll now. If you would like to answer this, you can feel free to send us an email with this information. I'm going to go ahead and end the poll now. And so we can see that a good percentage of folks said that there are opportunities for leadership development through their health department. But there's a good amount of folks who are not sure. So this kind of goes back to what our panelists mentioned earlier about BIPOC folks, especially not knowing about leadership opportunities. So that's kind of aligns with this. And then the challenges to leadership development. We will have to share those at another time because this is making me sign into Zoom, so I'm not going to do that right now. Okay, let's go ahead and if anyone wants to share any additional details, feel free to put those in the chat or in the Q&A function. And I'm going to ask all of our panelists to turn on their camera for the Q&A portion. I'm going to stop sharing my screen. All right, so one of the questions that came in, so I think this question was for Vrushab. Are there any tips you can share or secrets you can share about applying for MLP? This person said that they have applied before and were not accepted and are curious, what kinds of things should they be doing when they're applying?
Yeah. I'll just say that that is probably the most asked question in the history of MLP, as long as I've run it. And it's a great question. It's a fantastic question. So thank you for that, whoever offered it. I would say the biggest thing that we look for is a true commitment to, whether or not you're a repeat applicant or a first-time applicant, a true commitment to want to disrupt systems. Systems are what we know is kind of in the way of a lot of our BIPOC leaders, our gender minority, sexual minority leaders to advance. So we have a large pool of applicants typically who explicitly say on their statement of purpose, on their application materials, how they have lots of intensity and readiness to do this and that, but they don't have the tools yet. Those would be good candidates for MLP because they are coming in ready to challenge systems, challenge how things are working, challenge who's in positions of power, challenge what might be how folks are held accountable, how accountability is structured, what succession planning looks like, et cetera, et cetera. That's the first thing I'll say. And I think secondly, this does at the end of the day come down to a numbers game. We really can only select up to 12 to make sure that 12 to 14 to make sure that we keep the integrity of the program, the integrity of the experience alive. And I think one of the things to really highlight in your application is we do look at applicants who have applied more than once. We always make note of that. There is special consideration for folks who've applied more than once. So we don't want you to think that we're ignoring that piece of information. It is absolutely there, but it is always in assessment with the larger pool. And unfortunately, year to year, the pool is just different. And so there isn't a secret, like a shooting bullet, like a silver lining to the one thing that's going to make like the person who's applied twice or 3 times already like stand out, because at the end of the day, that will be different year to year. But I will say that our team we have a specific day dedicated in the selection process to reviewing applications that are repeat applications. So, we are mindful of it. We are looking through it. And we will continue to encourage you to apply because every year might be the year that that application stands out. So I don't know if that was super helpful, but that is the honest process for how we do it. And it's worked for us really well. And we plan to continue doing that.
And can you talk a little bit about the new application that just came out?
Yes, thank you, Krupa. So we did just launch our latest cycle. It is a little bit of a rebrand. It's called MLP Executive Activator. This version of the program is a little different than last few cycles because it is explicitly intended for executive level individuals. The minimum criteria for folks who who are qualified for this program is a cumulative, it's a hard word, cumulative 7 or more years of leadership, senior level leadership experience in the health department, we're counting experience outside of the health department too. And so that's why cumulative is the key word there. So 7 or more years. This is going to be a much more competitive application pool because this is not going to be a 2-week retreat. This will be a 1-week retreat this year. It will be in August in Tucson, Arizona. The content will be more catered towards senior level health department and community-based organization staff. So this is not for folks just beginning their leadership journey. This is for folks who have been in leadership for a number of years. We launched the application. The deadline to apply is going to be April 29th. And we will be hosting a informational webinar next Wednesday at 2 p.m. Eastern Standard Time to continue fleshing out the distinction between the traditional MLP and then this year's MLP Executive Activator. Previous MLP alums can and are eligible to apply, but priority will be given to new and first-time jurisdictions who haven't been part of the program before. We will be doing this year. This is kind of like we're doing this kind of as a pilot run this year, and then we'll see how things go. But the intention and plan for next year is to go back to the traditional MLP, which will be the two retreat cycle. So if you know folks who would be interested in applying, please share the announcement. I think Krupa can forward that to everyone on this call. We would be so happy to have your colleagues apply. But that is the new MLP this year. I'm very excited. And I hope you are too.
All right. This question is for Keishla and for Lori. Can you talk about how your participation in these programs has impacted your work in HIV prevention and care?
Hi, everyone. So this is Keisha from Massachusetts Department of Health. And just for a little background, like our program is an integrated program. So we do STD and HIV prevention and follow-up and surveillance work. So sort of like the both combined. So as soon as I got back, one of the biggest things that I did was I met with my supervisor and we really started to like strategize and think sort of like larger picture of the work that we had ahead of us and really come up with a year plan. And one of the outcomes of that strategizing really was to create a contractor role so that they can assist us with a quality improvement project for the next year, really looking at the division protocols and resources and trainings that are being provided to the field epidemiologists which are DIS, we call them field epidemiologists in Massachusetts, which are doing the HIV prevention and follow-up work in the field. So that's sort of like one of the bigger things that happened as soon as I got back, in that we are like full force and we finished interviews for this contractor role. We're hoping to get them started first week in May. So again, really strategizing and looking at the whole year as a whole and looking at like where our priority work should land. And if we do need assistance with that, go ahead and create those contractor positions so that we can get the help necessary.
One of the things that I was able to do upon my return after our in-person that needed to happen in terms of our providers within Kentucky, it was initiate a couple of stays to ask, what's going on. Since been to start up, it's almost finished, a provider detailing for HIV routine testing for our providers across the Commonwealth. And after this is basically we're looking at a stigma index for Kentucky. We want us to really on. And so I think the mentorship program to meet people who had great ideas, people to meet, say, oh, it's this back, and let's see what you and we've been able to really, if it happened, we've been able to out a program.
Thank you so much. We are almost at time, so I just want to be mindful of that and share a few resources. So these are just a couple of things to point out. There are various other resources out there on leadership development, but these are some things that NASTAD has done as well as some of our national partners. So we have another webinar series that we did a couple of years ago on workforce development. That talks about workforce development within health departments, within community. Our colleagues at NACCHO, which is the National Association of City and County Officials, health officials, they have a couple of resources on leadership and management, adaptive leadership. They have a toolkit on multi-level leadership. Our colleagues at NCSD, which is the National Coalition of STD Directors, have recently started some sessions called Speaks, which are focused on policy. And these are for folks who work in the STI sector. So we've shared that through the EHE listserv and can share that with folks on this call. If you did not receive that, you can also visit NCSD's website. Our colleagues at CSTE also have a couple of things happening. They have a CST lead program, as well as CSTE Learn courses on leadership. And CSTE is the Council of State and Territorial Epidemiologists. And then also, there are these national conferences and meetings that folks can go to, such as the STI Prevention Conference, the Sexual Health Conference, the Ryan White Conference, and then some of these other meetings and conferences as well. Finally, just want folks to be aware that our next webinar will kind of continue along the same lines of what we talked about today, but we'll focus on workforce and leadership development of community. So that will be on Monday, May the 6th at 2 p.m. Eastern, 11 a.m. Pacific time. And we do encourage you to reach out if you would like technical assistance. You can do this through NASTAD's website as well as the CTS, CDC CTS system. Feel free to email me directly as well if you have questions or would just like to talk through technical assistance. We are available to support you. So thank you all so much for being here today. Thank you to all of our panelists for taking the time. We really appreciate all of your insight and expertise. And thank you to our CDC partners for supporting this webinar. And thank you to all of you for joining. We will be sharing the recording and slides, so please look out for that. And we hope to see you next month at our next webinar. Have a good rest of your afternoon, everyone.